The postpartum period, also known as the 4th trimester, is a very important part of the end of pregnancy. This period is sometimes often overlooked, but it's very important to follow up with your physician to check in on your symptoms. Postpartum bleeding occurs because after the placenta separates after delivery, there's still a thin layer called the decidua left behind in the uterus. As the uterus continues to heal and decreases in size back to its pre-pregnancy size, bleeding occurs. This bleeding may occur for 6 to even up to 8 weeks at a time. It may be heavy, it may be moderate, and it may be light. If you're experiencing heavy postpartum bleeding, soaking 1 pad an hour, or large blood clots, or you're feeling extremely fatigued or feeling symptoms like you're going to pass out, please notify your doctor immediately.
If you do have a vaginal laceration during your delivery, there are a number of ways to care for it at home. First, you should make sure that it stays dry and clean by changing your pads if they become soiled. You also will want to make sure you're managing your pain with ice packs and by taking over-the-counter medications or prescription medications that your physician gives you. You should call your physician if you are experiencing severe pain from your vaginal laceration that isn't decreased by the medications that you're given to manage your pain. You should also call your physician if you experience significant bleeding from your laceration or you have a foul-smelling discharge.
After your C-section, the healing process can be complex and lengthy. There are some problems that may occur, which is increased abdominal pain, infection, increased bleeding. At your incision check, which is usually 1 to 2 weeks after your C-section, your doctor will inspect your incision. The doctor will check for any signs of infection, which could be increased redness around the incision site or severe pain. The doctor will also make sure that you're feeling overall okay at this exam. If your pain is increasing significantly despite Motrin and Tylenol, if you see severe redness or tenderness around your incision that is much more severe than it was upon discharge, or if you have a weird odor coming from your incision, it is starting to open up and it is leaking pus, please call your doctor. Postpartum pelvic and back pain that lingers can be common. This sometimes is not discussed as much with your physician. Please bring it up. In regards to lingering pelvic pain, again, you should not have this lingering after 6 weeks. If you have severe pain, especially with intercourse, please discuss it with your doctor. If you're experiencing persistent pelvic pain at home, again, Motrin and Tylenol for discomfort, along with sometimes warm compresses or sitz baths. But if the pelvic pain lingers despite the things that you have done at home, physical therapy is a very good option. Although some patients tend to skip their postpartum appointments, it's very important that you follow up with your physician to ensure your healing process is going smoothly. It's important that you see your physician within the first 4 to 6 weeks after your delivery. If you would like to request an appointment, you can go to womenshealthct.com to learn more.